Hi, my name is Dr. Dan. I use he, him, his pronouns. Could you tell me your name and how would you like me to address you? Okay. Thank you. I'm glad you can join me today for this telemedicine consultation. Sorry to hear you've been feeling sick lately. I understand you've been anxious about COVID-19 and have some questions for me? Okay. I'd be happy to help out. Do you mind if I take some notes with my clipboard while you talk? Great. Give me 1 second. All right. I already have some of your basic demographic information that my medical assistant took before our appointment today. And I want to personally thank you for scheduling a telemedicine appointment instead of an in-office visit. Even though we're doing everything we can to keep our patients and healthcare workers safe, the safest thing one can do if they have mild symptoms of COVID-19 is to stay home and use telemedicine services to network with their healthcare providers virtually, rather than visiting an office or a hospital. This helps reduce the spread of the virus in the community. Can you tell me about what symptoms you've been having and how long they've been going on? Okay. All right, so fevers, how high have they been? Okay, up to 101.4, okay. Cough, okay. You've been feeling fatigued, okay. When did this all start? 2 days ago, okay. Have you been in prolonged close contact with anyone that's tested positive for COVID-19? Okay. Your younger brother. Okay. What symptoms did your younger brother have? Yeah. Flu-like symptoms. Mild. Milder than yours. How old is your brother? Okay. That actually makes sense. Those who are less than 20 years old tend to get a milder form of the disease. Reasons are still being worked out, but we think it may actually have something to do with the immune system responding differently to the virus in people who are younger than 20. Yeah. Do you have any other medical problems? No? Okay. Great. Have you had any surgeries in the past? Okay. Appendectomy. Okay, good. Do you have any medical problems that run in the family, like your mother, father, brothers, or sisters? Okay. Dad has hypertension and type 2 diabetes. Mom has asthma, history of breast cancer. Say, brother has asthma. Got it. Okay. All right, you've already told me some of your symptoms. I'm going to ask you a bunch of questions in a row. Could you tell me in the last week if you've had any of the following symptoms? Headache, loss of smell, runny nose, sneezing? How about shortness of breath? Sore throat? Okay. Neck pain? Abdominal pain? Diarrhea? Okay, good. Moving on. Do you currently or have you ever used tobacco products? This can be cigarettes, vapes, chewing tobacco. Okay. How many packs are you smoking a day? Okay. Have you ever thought about quitting? Okay. There's never been a better time to quit smoking than right now. COVID-19 has a higher probability of being severe, enough to require hospitalization in those that have underlying lung diseases like asthma or COPD, even those who smoke. quitting now could save your life. Okay, so you are interested in quitting. Okay, we'll talk a little bit more about that on your next visit. How many drinks of alcohol do you drink per week? Okay, 2 drinks a week. Have you used any illegal drugs like marijuana, cocaine? No. Okay, good. I know that was a lot of questions that have nothing to do with coronavirus. I'm sorry I asked these of every one of my patients. Now, what we're going to do is, first of all, I'm going to check availability to see if we can get you set up with drive-through testing for coronavirus. So early in the pandemic, we were focusing our testing primarily on those who were most likely to get severe disease. These were people over the age of 60 who have other health problems like lung disease, like we talked about, heart disease, hypertension, diabetes, or immune-compromised conditions like cancer or HIV. Also, people who've had a plausible exposure history, like someone who had recently traveled to an endemic area. Now that more testing sites have been opened, getting testing for those who have milder cases, like yourself, is actually becoming more plausible. However, if we still can't get you into testing safely without risking infecting others, it's still acceptable to just shelter in place. As most folks that are your age with just mild symptoms are okay to shelter in place as long as they're not having worsening shortness of breath, and just wait 2 weeks. Okay? Hopefully we'll be able to get you in for drive-through testing and do the testing. You do know how the testing is done, right? No? Okay. So the method they're using here at the drive-through testing is doing nasopharyngeal swabs. I actually have one of the swabs here. Let me get it for you. So it looks like this bit of lung and pleasantness. And unfortunately, this doesn't just swab just inside the nose. No. It has to go all the way back. It goes straight back to the base of the nasopharynx. And there, we rotate it, make sure to get all of the walls, and then we place it in a viral transport media that looks like this. Now, the testing initially was taking several days for it to resolve. Now, we have testing modalities that can get us results in under 30 minutes. And what it's testing for is the genetic material of the virus. The virus is called SARS-CoV-2. You may have heard the term COVID-19 as well. COVID-19 is the name of the disease. The virus that causes it is SARS coronavirus 2. A good analogy for this is HIV causes the disease known as AIDS. Okay. Any questions for me so far? Good. When you go for testing, they may also check to see if you have influenza or other respiratory viruses, as the symptoms of COVID-19 can often mimic other viral respiratory conditions. There's also a brand new blood test. It's just starting to be released now. And the nice thing about the blood test, not only is it fast, but it'll tell us if someone has already been exposed to the virus. Why this is helpful is if, and we don't really know this yet, if the proteins that we form in response to the virus, which we call antibodies, if these antibodies are protective against reinfection, we could potentially allow folks that have had the disease already to safely return to work without fear of exposing others or being re-exposed themselves. Everything makes sense so far? Any questions? Good. one more thing about the blood test that's really interesting. So, we're actually testing now to see if the plasma from those who have recovered from the disease, something we like to call convalescent serum, could be transfused to someone that has severe symptoms, that may be on a respirator, a ventilator, or using a device that we call ECMO. And if those antibodies from someone who's now healthy and has recovered from the disease may help those whose immune system are not fighting off the virus very well, it may help them potentially survive their illness. However, this very, 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 very old method of using convalescent serum is still a relatively new idea in COVID-19 and has not been conclusively shown to be effective therapy just yet. But keep an eye out. Okay, so what other questions do you have? Okay, so you want to know about medical treatments. You heard on TV that you should be taking hydroxychloroquine. Yeah, I get a lot of patients that ask me about it. The thing about hydroxychloroquine is I've been paying attention to the drug for a long time. It's an old malaria drug, but it has some interesting antiviral properties. Specifically in this case, it may work two different ways. So the virus enters in through your cells through this process called endocytosis. And typically, these little balloons that encase the virus, called lysosomes, they're very acidic. But the virus, it wants that. It wants an acidic environment. Hydroxychloroquine raises the pH, makes the lysosome more basic, which may mean the virus can't escape from the lysosome as effectively. The other method in which hydroxychloroquine works is it may serve to blunt the immune system response to the virus because, while many people think, well, the virus is what's causing people to die or what's causing people to be very sick, have shortness of breath, potentially be on a ventilator, it's actually, the virus is only part of the equation. So the virus can directly damage the cells of the lung, these cells that line the surfaces of little air sacs called alveoli. And these types of cells are called type 2 pneumocytes. So yes, the virus does damage these, but part of the problem is also the immune system response to the virus. This may explain why children can just as easily be infected with the virus as everybody else, but their symptoms tend to be milder. It could be because their immune system is responding to the virus in a different way. A lot of these ways are still being worked out, but it's believed that hydroxychloroquine may diminish some of the inflammatory response, something we call cytokine storm. And by diminishing that cytokine storm, especially early in the disease, we may be able to preserve some of the lung function. But one important caveat, most of the tests that have been done on hydroxychloroquine, specifically in this disease so far, have been in lab settings using mice kidney cells or different cell types in a very controlled lab setting. And there have been a few publications that have used a small number of patients that were given a combination of hydroxychloroquine and an antibiotic called the azithromycin. However, these studies were not what we call randomized control trials. So, do you know what a randomized control trial is? I'm sorry if I'm getting a little off track. No? Let me nerd out on you for just a second. So, the best types of medical trials that we do, what we do is we take two groups. One group will get the standard of care, what is normally done. The other group will get the same standard of care, but they'll have the treatment which you're investigating applied. Otherwise, the two groups should be matched, meaning one group doesn't have sicker patients than the other group. They should be matched groups. Also, randomized, meaning the person running the study doesn't get to choose who gets to be in what group. No, we randomize it. And then, even better, if we can double blind it. A double blind study means neither the people running the study nor the participants in the study know if they're getting the experimental treatment or if they're getting standard of care, which often involves a placebo medication that looks just like the medication that's being studied. That way, we don't incorporate bias into the study. So those studies for hydroxychloroquine haven't been done yet, but they're being done right now. Right now. And it's being looked at for use in both prevention, shortly after exposure of developing COVID-19, and early in the disease. But at this time, I want to make this very clear. There is no proven official medication regimen for COVID-19. As of this date, this is being teleconferenced, which is April 14th, 2020. And this includes the things you hear on the news, like remdesivir and tocilizumab. A lot of these medications already exist and were being used for other medical conditions like rheumatoid arthritis or other viral conditions. In the case of remdesivir, it was looked at for Ebola. So the benefit of that is the medications have already been looked at in human use. So quicker to get to market. But right now, we're still not sure at how effective these are in COVID-19. Okay, what's your next question you have for me? Okay. So you want to know how coronavirus is transmitted and what you can do to keep your family from getting sick. Those are good questions. So, coronavirus is primarily transmitted through what we call droplet respiratory transmission, which means coughing, sneezing, even if you're close enough to someone, just breathing on them, talking to them at very close proximity can transmit the virus. Also, the longer you're in that close proximity or a close contact, the more likely one is to get it. And this is why social distancing, separating yourself by at least 6 feet, is everyone's primary weapon in their arsenal to protect against coronavirus. And the second method, now this method is a hypothetical method, but it's been seen in other disease epidemics, is something called fomite transmission. And what fomite transmission is someone with the disease coughs on or breathes on a surface, maybe a bedside table, maybe a cup. And then an uninfected person touches that surface. But there's a very key step that must happen next. They must not only just touch the surface, but they have to touch their eyes, their nose, or their mouth. If they don't do that, they don't get infected, if by just touching it. And this is where hand hygiene comes into play. That if you're ever concerned that you contacted a surface that may be contaminated, don't panic. Just immediately perform hand hygiene, either using a hand sanitizer or better yet, soap and water for 20 seconds, making sure when you do, you follow the WHO hand washing guidelines, which I will provide you a link in your discharge paperwork after today. Okay, so you don't have any disinfectant wipes. And you need to clean surfaces. Okay. Do you have any laundry bleach at home? Yeah. Okay. So you can make your own disinfectant wipes. This is what you do. Take a container and place 1/3 cup of bleach in 1 gallon of water. Mix it. And make sure when you're doing this, you're wearing gloves and eye protection and doing it in a well-ventilated room. And then take some paper towels and soak it in the bleach solution. Once they're thoroughly saturated, wipe down any infected surfaces, making sure that the surface is left wet and allowed to dry before you contact it. Yes. I know there's been a lot of shortages on alcohol, hand sanitizer, and disinfectant wipes, but doing this particular DIY method has been shown to be very effective. Good. Okay. The other thing that's really important to keep your family members from getting sick is, if any of them are within 6 feet of you, is to wear a surgical mask like this. One of these masks. It just goes on the face like this. And if you have extras, making sure your family members, if they're going to be within 6 feet of you, also wear one of those will help reduce the risk of them also getting sick with coronavirus. Besides, of course, hand washing, like we talked about. Okay. Yeah. So early studies showed that before there was social distancing and frequent hand hygiene, the majority of coronavirus spread was between family contacts. And the rate of spread was about 10%. When they employed social distancing, hand hygiene, using surgical masks like this, the rate of transmission to family members dropped to 3% in early studies. So it's very effective. Social distancing, hand hygiene, and mask usage for those who are sick. Okay. That's good question. That's one I get a lot. Yeah. If you could still play with your dog. Yeah. So there's actually been studies done on this, and it seems like dogs don't get sick with this virus. So the other thing is cats looks like could potentially be infected with the virus, but don't get symptoms. More importantly, they don't seem to transmit it to other cats. They don't seem to transmit it to other humans. The data that I was able to find on this is still relatively limited, but so far it looks very promising. If you're really concerned about it, try to limit your contact with your pets if you have COVID-19. Okay. Yeah. So I see in my video that you have an N95 mask. Yeah. Did anyone ever show you how to properly don and doff an N95 mask? No. Would you like to learn now? Okay. Let me show you. Oh. Actually, I don't have my N95 mask here, so I'll have to show you in another video. Perhaps a relaxing trigger video. How's that sound? Something to help you to sleep. Sounds good. Good. So, as long as we're on the topic of N95 masks, the question I get asked all the time is, Dr. Dan, I can't find an N95 mask anywhere. Where can I get an N95 mask? Should I be wearing an N95 mask? And the answer to that is no. N95 masks right now in the treatment of coronavirus are very important for healthcare workers when we're performing certain types of procedures that generate aerosols. These procedures include doing intubations, where we have to put a patient on a ventilator, or nebulizer treatments. These procedures generate large amounts of aerosols that can stay in the air, potentially. However, at this time it's believed the virus is not transmitted from person to person, like if you were coming across someone on the street, via airborne methods. This is really important because some infectious diseases, like measles, can stay in the air for 2 hours, even after the person has left the room. And then someone can walk into the room and get infected with measles if they don't have immunity. The data that's been studied so far, and it's quite a bit of data, 75,000 cases were looked at, and there was no evidence of airborne transmission. And why this is so important is, if it was airborne transmission, things like social distancing may not necessarily work if the disease can be acquired by just breathing the air that someone had the disease breathed out 2 hours before. And we're not seeing that type of transmission right now. But the N95 mask is used for airborne transmission diseases primarily, versus a surgical mask like this is used for droplet respiratory transmission diseases, like COVID-19. Yeah, the cloth mask, CDC just changed their recommendations on that. So, I can't stress this enough. Even if you're wearing a cloth mask, you still need to social distance. The cloth mask's utility really comes into play if it's a crowded environment and social distancing is impossible. However, I would recommend avoiding those situations altogether. But what a cloth mask may do is it's potentially, if someone is either pre-symptomatic or asymptomatic. Pre-symptomatic means a person's been infected with the coronavirus, but they haven't had any symptoms yet, but they're still transmitting the virus and potentially infecting others. And this can happen 24 to 48 hours in some cases before someone gets symptoms. Asymptomatic transmission is much more rare. We think it's maybe 1 to 3% of transmissions. And asymptomatic transmission means someone's infected with the virus, but they don't show any symptoms at any point. But pre-symptomatic transmission, much more common. And a cloth mask may help reduce that. But, again, don't be fooled. A cloth mask is not adequate personal protection equipment. You should always employ social distancing. Yeah. Okay, so you've been cleaning down all your packages you get from Amazon. Okay. And you're wondering if you should be doing that. Yeah, I get that question a lot too. So what I would recommend to people is, if it's causing you a lot of anxiety to clean off all your packages, Amazon boxes, and groceries, a better thing to do, maybe after you're done handling all of them, is just to wash your hands and avoid touching your face while you're handling things that may have been potentially contaminated. Yeah. Okay. So you want to get some delivery, some DoorDash. Okay. And you're worried about coronavirus on that? Okay. So most government organizations have stated that food delivery is not thought to be a method of coronavirus spread, especially if the food is served hot or can be reheated. Coronavirus is very easily deactivated by heating. So, primarily, we think it's being transmitted via droplet respiratory transmission and potentially fomite transmission. Yeah. Vaccine, yeah, we're all hoping for it. When do you think it's going to be available? So vaccines had to be tested for safety and go through clinical trials, much like the ones we talked about earlier. And we're anticipating, if an effective vaccine candidate is found, we're hoping that it'll be available in the first half of 2021, which is why it's so important right now that we continue social distancing and shelter in place where it's needed to avoid spreading the virus before we have a vaccine. Good. Okay. So I just heard back. It looks like I can get you the drive-through testing. Yeah. It's at the junior high. Yeah. Truman. Yeah. It's about 2 miles from your house. Yeah. You could show up anytime this afternoon. Good. Okay. Do you have any further questions for me? No? Well, after you get tested today, I'd suggest checking out my relaxing medical trigger video, where I'll show you how to properly don and doff an N95 mask, as well as some other fascinating triggers. I hope you learned a little bit about coronavirus today in a very relaxing method. This is Dr. Dan, signing off.